Hey everybody, this is Dr. K. I wanted to talk about how we heal. First of all, it's important to talk about the conditions for healing to happen in the first place. It is vital that we engage our thoughts and our intention toward this process so that we can galvanize our actions in the effort of making that happen. That means positive self-talk, not talking bad about your body, and really believing that it's possible for you to heal. Having that in mind, that we are self-healing, self-repairing, gives you a greater understanding of the reality that our contribution is very small. Behind the scenes, there's a lot going on within our bodies, systems interacting with each other, making things what they are. So it's important to see it in your mind and also take action with that belief. Healing really does happen with force from the outside in. You can't just will healing to happen. Of course, healing is happening on its own, but it does need assistance, especially when you have gone beyond the limits that your body can handle, and it just needs some extra assistance. Being able to use force through either chiropractic manipulation or foam rolling or any kind of force from the outside in, lacrosse ball, what have you, it's important to go to tolerance. Put that force to tolerance into the body. That first engagement might be a little painful. In that case, draw back just a little bit and go at a force to tolerance that you can really live with for that moment. Make sure you're breathing so that you can kind of take time to assess, how is it going? Because more likely than not, after a few breaths, you'll notice that your pain is diminishing in the moment, which will give you further information for the next time that you do it, that, hey, you did improve, or it stayed the same, or maybe it got worse. But it's important to be consistent in the ways that you put force into your body. When you do that too, there is an inner awareness, a guide, because pain is a guide for us. And when we are consistent with our efforts, we have a baseline for how we did that first time. And in that, it gives us breadcrumbs for going forward. The healing that happens really by force, lots of physiological things happen, in our bodies. We are moving blood. We are recalibrating the brain and body connection, making sure that all the data received from our environment into our senses through touch are appropriate, are raw in their experiencing. They're not overly dramatic or heightened because of inflammation influencing our bodies. So the important thing with healing is to put force so that we can make changes within our body, push out inflammation, bring in fresh oxygenated blood, change muscle tone, and thereby increasing the durability, the integrity of both the structure of the skeleton and the moving parts, and also the functioning, how our muscles and tissues are coordinating in really all of these activities, because you do want everything to be just wonderful and happy and at ease when it's moving. So that's how we heal.